More Americans have now died from COVID-19 in the last 3 months compared to the entire Vietnam War. Yet many states are rushing to reopen their economies prematurely while thousands continue to die daily and thousands more continue to get infected. In order to safely open up your state, you have to at least get the basics in order first. In this video, I'm going to highlight what I would argue is the most fundamental aspect of dealing with a viral outbreak and the danger and flaws in the logic of those promoting opening the states right now. One of the single most important aspects of dealing with any deadly viral outbreak is to ensure that there's adequate testing. In order to understand why testing is so important, we need to understand how viral outbreaks work. Viral outbreaks literally work the same way as viral videos. What happens is one person shares it with their friends, then they share it with their friends, and before you know it, it's become a viral video. This is a simplified version of exponential growth. To give you an even more insane example of exponential growth, if someone gave you a chessboard and asked you to put 1 grain of rice on the first square and double the number of grains of rice from one square to the next, so 2 becomes 4, 4 becomes 8, and so on. If you kept doing this all the way to the 64th square, how many grains of rice would you have? Well, the answer is this, and I don't want to have to read the insanely large number out, but this number is 923 times the entire estimated global production of rice this financial year. And the really scary thing about exponential growth is that you may think you are safe because it seems like you have plenty of time left, but due to the nature of exponential growth, if you don't take immediate action, you won't have any chance of getting out of the situation. Early data suggests that the R0 of the coronavirus sits somewhere between 2 to 2.5, whereas the seasonal flu sits with an R0 of 1.3. The R0 measures the average number of secondary infections caused by a single case. That is to say that one person on average infects another 2 to 2.5 people. This R value can go up or down depending on whether or not people follow preventative measures such as testing, contact tracing, and social distancing. And until we have a vaccine available, we have little other options to reduce its spread. So due to the highly infectious nature of the coronavirus, testing is incredibly important, especially in the early stages of the viral outbreak. This is because each person you detect and isolate can prevent them from infecting others, and can potentially reduce the N number by many millions depending on how early you detect it. This is the reason I was so worried at the early stage of the outbreak in the United States, as shown by this video back in late March. Both countries reported their first cases of coronavirus on the same day. South Korea's testing rate is already 6 times higher than the test rate in the US. So far, the US test rate is about 1,000 tests per million, and South Korea's is 6,700 tests per million. And you can already see what this early testing did. Firstly, it allowed the accurate identification and tracking of those infected with the coronavirus, and secondly, it slowed the spread. With America, because there was so little tests done during the initial stages, there was a lag to the exponential curve. And importantly, just because this graph is flat for a very long time compared to Korea's, it doesn't mean that people just magically got sick here. What it means is that people were sick this whole time, they just weren't being tested. And unfortunately what this means is that this exponential curve is going to keep rising for longer than it did in Korea. And this is what the same graph looks like just over a month later. You can definitely see that early preventative measures such as testing and contact tracing made a huge impact on the ability for the coronavirus to spread. It also meant that because South Korea contained the spread early by doing aggressive testing, they actually require less testing in the long run. However, in saying this, some people such as the ever insightful Tucker Carlson on Fox News are reporting that the curve has been flattened and therefore it's safe to reopen.
The famous curve they told you about has been flattened.
There is so much other stupid shit he says in the clip, which has no basis in science or facts, but I just want to deal with his claim that the curve is flattened. Now, I don't know where he is getting the data from that the curve is flattened, and it appears that he's speaking generally of the United States, so I'm pretty sure he just doesn't know how to read a logarithmic graph. But Vox explains it best.
There's no fixed amount of space on this chart for a certain number of cases. So the first 100,000 cases take up this much space, and then the next 100,000 cases get just this much. The higher the numbers, the more visibly squished they become on a log scale.
Now, it is very hard to generalize when it comes to the United States, as there are 50 states with varying degrees of cases and restrictions in place. But I'll just use Dr. Fauci to sum up my position.
So the concern that I have is that there are some states, some cities or what have you, who are looking at that and kind of leapfrogging over the first checkpoint. And I mean, obviously you could get away with that, but you're making a really significant risk that if you do that and you don't have in place the absolute clear-cut capability of identifying, isolating, and doing the contact tracing, when people do start blipping.
It continues in that same interview by stating, "There's no doubt in my mind that when you pull back mitigation, you're going to start seeing cases crop up here and there. And if you're not able to handle them, you're going to see another peak." But I will be getting into reopening a bit later, but for now I want to continue to delve deeper into testing first. There is a common saying in academia and science that test what test. Basically, if you don't test for a particular thing, then you don't get the correct answer. That's why it's important to make clear that tested cases does not equal actual cases. So when Trump touts something like this,
all I'm saying is this: how do you close down the greatest economy in the history of the world when on January 17th you have no cases and no death? When on January 21st you have one case and no death. One case. Think of that. Now we're supposed to close down the country.
Now in the full clip, CNN reporter Paula Reed does a fantastic job at pushing Trump about what he did in February, which I've already dealt with in a previous video, but I wish journalists would press Trump on the fact that tested cases does not equal actual cases, and due to inadequate testing, the first case and death were likely much earlier than currently known. In fact, the real number of coronavirus cases in the United States right now is likely to be significantly higher than currently reported. The former FDA chief, Dr. Scott Gottlieb, believes that the cases could be 10 to 20 times higher than the current tally of coronavirus cases. One study by the University of Southern California and the LA Department of Public Health, which looked at the outbreak in Los Angeles County, estimated that the actual cases of coronavirus could be 28 to 55 times higher than the 7,994 confirmed cases right now. The good news though, if this is correct, it could mean that the county's fatality rate is lower than originally thought. However, I'll get into how this is most likely not the case when I talk about the death toll of the coronavirus in a little bit. But for now, let's continue to dig deeper into testing. There is most likely to be rampant underreporting of coronavirus cases, and this is most likely due to inadequate actual tests conducted and tests processed. And as I've previously said, you only know the actual number of coronavirus cases if you test enough people. The later you leave the testing, the greater amount of potential positive cases there are. Just a quick background to the next part. To understand why there appears to be no current correlation between tests conducted and positive test rates, I reached out to the guy who created this dashboard, which reports the deaths, positive tests, and tests conducted. I wanted to know if the tests per day meant that they were conducted or processed on that specific day, and if the positive tests came directly from the tests conducted on that day. It appears that they are two separate things, where the test section reports the tests conducted, and the positive section, it reports the specific date that the test was actually processed. Unfortunately, what this appears to highlight is that there is a massive backlog in finding out the results of the tests. So there appears to be two problems going on. Firstly, there is inadequate testing conducted, and secondly, the ability to process these tests is also limited. In order to further understand why the positives appear to plateau compared to the tests conducted, a recent article by The Atlantic looks at the question of why America's COVID-19 numbers are flat. On the 16th of April, at the time of the article, America had 630,000 people nationwide test confirmed cases of coronavirus. Test positivity rate is basically where if you have 1 person in 5 testing positive to the coronavirus, there would be a test positivity rate of 20%. The test positivity rate for the United States appears to be between 10 to 20%. The positive test cases per day over the last month tended to plateau at around 30,000. To make sense of this, at the time of recording this video, the United States has just done over 6 million tests, or around 2% of the population, which now equates to around 200,000 tests per day. If 10 to 20% of these tests are positive, that would equal a rate of around 20 to 40,000 positive cases a day. Now, it is actually possible that positive cases have actually plateaued around 30,000, and that would mean that tests are actually capturing a good chunk of those who are actually infected. The big problem here is that we all know that coronavirus can propagate without symptoms, and those without symptoms can still spread the virus without even knowing it. It's most likely that the number of confirmed cases is hovering around 20 to 40,000 because testing capabilities have reached their cap. When it comes to underreporting the deaths, the only way to know if someone has died due to coronavirus is to test them just before or post-mortem. There have recently been reports that state officials in Florida are stopping the release of the list of coronavirus deaths that have been compiled by Florida's medical examiners. This list has at times shown a higher death toll than the state's published accounts. I've also recently heard or read that a lot of people are saying that coronavirus-related deaths are overreported because they're attributing their death to coronavirus rather than their other underlying conditions, like diabetes or hypertension. The thing is that they should be definitely recording these deaths as coronavirus-related deaths. Take, for example, if someone has a condition such as diabetes and their average life expectancy is 20 years after the diagnosis, but they die after only 1 year, while also simultaneously having the coronavirus most likely precipitated the death. One way to find out how many more deaths have been caused by the coronavirus is to compare the current death toll to the normal death toll of the same time. These average death tolls take into account things like heart attacks, cancer, and flu, etc., with the only main difference being that there is coronavirus now. A recent article by the New York Times reports that the US coronavirus death toll is far higher than reported, CDC data suggests. The article specifically looks into the death toll over time of different states and cities who have recently had massive outbreaks, with the average mortality toll of the previous 5 years represented as the green line and the current death toll of 2020 being in red. If you look at New York City for March specifically, you can see a massive spike in deaths. And it's not just New York City that has shown these massive increases in death over the last couple of months. It's also New Jersey, Massachusetts, and the list goes on. The total deaths in the 7 states hit hardest by the coronavirus outbreak are nearly 50% higher than normal for the 5-week period between 8th of March and the 11th of April. This increase in deaths is not limited to just the United States. It has been shown around the world in such places as Spain with a 51% increase, and Ecuador with an 80% increase. While correlation doesn't always mean causation, I can't find any other data to explain these massive peaks in death toll. The really sad thing is that many Americans will continue to become infected and continue to die due to inadequate testing and inadequate preventative measures. It's also telling of the incompetence of the Trump administration. If the Trump administration had taken the pandemic seriously and dealt with it competently from the start, the 2 things he loves the most could have been saved. Firstly, his precious economy, as other countries such as South Korea are preparing to reopen safely, and secondly, it could have had easy victories in the polls, as tragedies are generally favourable for presidents during these times. The big issue going forward is that many states are attempting to reopen their economy prematurely, without an accurate account of the current coronavirus cases, due to inadequate testing. Due to the highly infectious and possible asymptomatic nature of the coronavirus, it is likely that the states which haven't experienced a peak in confirmed cases are currently experiencing an unrecognized surge that is not being accounted for. And there has recently been many anti-lockdown protests in places such as Michigan, Ohio, and Kentucky, and these type of events will cause even further surges in coronavirus cases. Ultimately, these anti-lockdown protests cause further stress on the healthcare system and actually unironically increase the time necessary for lockdowns. We've even recently seen the leader of the reopened North Carolina protest group test positive for the coronavirus. Regardless of whether these people think these protests are appropriate, if they are to get sick, they could potentially infect those who are most vulnerable, such as their own or others' grandparents, who may ultimately die. If they require medical help, they could be denying someone medical attention who is doing the responsible thing, due to unnecessarily overwhelming the medical system. In these times, we must think of those who are actually having to deal with the coronavirus pandemic. While many of these protesters are able to stay home and quarantine, millions of medical professionals and essential workers are risking their lives working every single day while being emotionally and physically exhausted. Not only this, they are working in environments which can lead to their own family members getting sick and dying. They deserve the right not to be overburdened by idiocracy. They aren't the cause of this pandemic, but they will be the ones fixing it. Thanks for watching, guys. If you like this type of content and want to help support the channel, please smash that like and subscribe button with your anti-lockdown protest signs. Follow me on Twitter so I can see what you are all up to, and feel free to check out my other videos. And as we always say here, don't forget to wash your hands.